So, hello, my name's Elanni Tijerina, and my topic was funding for Planned Parenthood. So, the roadmap of what I'm going to be discussing today is a brief introduction on the topic, my declared position on the topic, definitions that help understand the situation, a historical context, detailed argumentation of the arguments from both sides, supporting evidence from both sides, and an evaluation and critique of everything. So, brief introduction. There has been an ongoing debate on if Planned Parenthood should be defunded because they perform abortions. Many people believe that Planned Parenthood, along with other family planning facilities, should be funded because these facilities benefit women's reproductive health, especially low income women. Others believe that any facility that performs abortions or even refers abortions should not be funded due to their disapproval of abortions. So, my declared position, I'm in favor of funding for Planned Parenthood. And that's because more peer-reviewed journal articles support funding for facilities, and the evidence that I have seen suggests that defunding family planning facilities can have adverse effects for low-income women and women's health in general. Some evidence that supports defunding Planned Parenthood has been proven to be false, which weakens their argument. So some definitions would be like what Planned Parenthood is. Planned Parenthood is a healthcare facility that provides reproductive women and young people. Another term would be Title X. It's a federally funded program that provides reproductive health resources such as contraceptives, breast and cervical cancer screenings, and HIV and STD testing. Title X was made to increase access to these health services for low-income women, especially, but it does not fund abortions at all. The global gag rule, it was a policy that bans any international group that receives US funding from providing abortions or providing abortion referrals. And the Hyde Amendment, which states that Medicaid cannot be used to fund abortions unless the pregnancy is due to rape, incest, or is harming the mother's health. Some historical context. So in 1970, Jane Roe filed a lawsuit against Henry Wade challenging a Texas law that made abortions illegal. In 1973, the decision was in favor of Roe, which protected women's rights to safe and legal abortions. So this means that the state can't intervene with abortions unless the female's in the third trimester. And since then, some presidents have tried to restrict abortions in other ways. So like in 1984, President Ronald Reagan first applied the global gag rule, which decreased funding to international services that provide abortion. And since then, Democratic presidents have repealed the global gag rule. Republican presidents have brought it back. So like in 2017, Trump made steps to further the global gag rule to any facility that provides or discusses abortion. And in March of 2019, he furthered these steps to any facility that supported groups receiving US funding. And recently, in January of 2021, President Joe Biden signed a memorandum to repeal Trump's restrictions on abortion. Detailed argumentation. So those who oppose funding for Planned Parenthood argue that Planned Parenthood illegally profits from selling fetal parts, that taxpayers are paying for abortions, which is against their moral beliefs. And they argue that funding does not necessarily create more access to services. Those in favor for funding argue that family planning facilities are beneficial to low-income women. They state that defunding leads to an increase in unintended pregnancies, and they also argue that defunding can lead to detrimental effects for women's health and infant mortality. So supporting evidence in favor of funding for Planned Parenthood. So as stated earlier, it's beneficial to low-income women. State family state family planning programs increase access to contraception and contributes to the reduction of disparities in use of contraception and unintended pregnancies. It can also um, defunding can lead to an increase in unplanned pregnancies. So there was a study done in Madagascar that observed the impact that the global gag rule had, and it actually contraceptive services were lost, and the ones that weren't lost had an increase in costs for the services. So many women stopped taking contraceptives, which led to unintended pregnancies due to lack of access and affordability, and even unsafe abortions. Defunding can also have adverse effects on women's health and infant mortality. So, because deficiencies in policies and resources render infants born impoverished at the highest risk for infant mortality, it's said that infant deaths would be more sensitive these if funding for these services were reduced. So those who oppose funding for Planned Parenthood state that they legally profit from selling parts, and this is because an anti-abortion group released a video in 2015 that documents how Planned Parenthood sells fetal organs for a profit, which violates medical ethics. And there's been arguments on this video. Planned Parenthood did state that they don't profit from they don't profit, but they do donate it to research. And it still causes a controversy. Many people still don't believe that to be morally right. Another argument would be taxpayers are paying for abortions, which goes against their moral beliefs. So since Planned Parenthood own funds to women enrolled in Medicaid, they should not receive Medicaid funding. So Medicaid does not pay for abortions, it does not fund abortions, but anti-abortion advocates state that they're basically saying they're finding a way around it and using their own funding to pay for women who are enrolled in Medicaid. And another argument would be that funding does not necessarily create more access to services, and that Title X funded sites were less likely to have extended hours or services tailored to minorities. So, my evaluation and critique, there's more evidence that supports the funding of Planned Parenthood and other abortion services. Funding for these services can improve women's reproductive health and benefit low income women. And I believe that argument will continue since it involves a difference in moral beliefs, which is the argument of pro life versus pro choice.